Hello, everyone. It's Dr. Emily Carter, and today we're tackling a topic that might feel a little personal, but it's so important for the health and well being of older women: bathing. As we gracefully move into our 70s and beyond, things change, including our skin and our body's needs. And while we all want to feel fresh and clean, the rules about bathing aren't quite as straightforward as they used to be. In fact, there are some surprising things you need to know about how often older women really need to bathe. So, let's dive into 8 shocking facts about bathing after 70 that might just change your routine. How often should older women bathe? 8 surprising facts. Now, when I say shocking, I really mean eye-opening and important for your health. This isn't about being sensational, it's about getting the right information so you can take the best care of yourself as you age. Let's get to these facts. Bathing too often can actually age your skin faster. Now, let me ask you, how often do you bathe? Every day? Maybe even twice a day? Because you've always been taught that cleanliness is next to godliness? Well, here's a little truth that might surprise you. If you're over 70 and still bathing daily, you could be unintentionally speeding up your skin's aging process. As we get a little more seasoned, our skin changes. It becomes thinner, naturally drier, and just more delicate. Our bodies just don't produce as much of those lovely natural oils that keep our skin feeling soft and supple. So, think about it. When you shower or bathe with soap and hot water every single day, what are you really doing? You're washing away what little precious moisture your skin has left. Think of your skin when you were younger, like a fresh, dewy rose full of life and radiance. But as time goes on, our skin becomes more like delicate tissue paper. And just like you wouldn't scrub fine silk with a rough brush, we need to be gentler with our mature skin. Now, you might be wondering, but Dr. Emily, isn't bathing every day essential to feel fresh and clean? Well, dermatologists who specialize in senior skin will tell you, for most women over 70, a full body bath or shower only needs to happen about 2 to 3 times a week. Yes, you heard that right? 2 to 3 times. On the other days, a quick refreshing wash-up of those essential areas, underarms, feet, and private parts, is absolutely sufficient. And here's something else to consider. What you bathe with is just as important as how often. If you're using those heavily scented soaps or taking long hot showers, you could be doing even more harm. Instead, switch to gentle, fragrance-free cleansers and keep your showers comfortably warm, not scorching hot. If your skin turns red in the shower, the water is too hot. If you're still bathing like you did in your younger years, it's time for a little adjustment because your precious skin will thank you for it. Overbathing can increase your risk of infections. Yes, really. If that first fact was a bit of a surprise, this one might really raise your eyebrows. Would you believe me if I told you that bathing too much can actually make you more prone to infections? I know, it sounds completely backward, but it's true. You see, your skin isn't just a covering. It's a remarkable active barrier that works hard to protect you from bacteria, fungi, and all sorts of little nasties that can make you unwell. And the secret to that protection? Your skin's own natural oils and something called the microbiome. Now, what's a microbiome? Well, your skin is home to trillions of good bacteria. Yes, good bacteria. These microscopic helpers actually work to keep the bad bacteria and fungi in check, preventing infections and all sorts of skin problems. But here's the thing, every time you bathe, especially with soap, you're scrubbing away at this natural protective layer. That means if you're overbathing, especially with harsh soaps or really hot water, you're washing away those beneficial bacteria, leaving your skin more vulnerable and less defended. And without that natural protection, your risk of infections can actually go up. Here are just a few of the common skin issues older women can face because of overbathing. Fungal infections. If your skin's natural barrier is stripped away too often, fungi like Candida can thrive, leading to conditions like athlete's foot or those uncomfortable yeast infections. Eczema and dermatitis. Overwashing can cause your skin to become red, cracked, and painfully inflamed. It just irritates sensitive skin something awful. Bacterial infections. Your skin is your first line of defense against harmful bacteria. But when that protective barrier is weakened, bacteria can sneak in through even the tiniest cracks, leading to painful sores or even cellulitis, which can become quite serious, especially for us as we get older. And guess what? If you're using antibacterial soaps thinking they're extra helpful, you might actually be making things worse. Many of these strong antibacterial products wipe out the good bacteria right along with the bad, leaving your skin even more vulnerable in the long run. So, the next time you're tempted to jump in the shower, just to be sure, remember this: your skin has its own amazing defense system. Cut back on the overbathing, use gentle cleansers, and let your wonderful body do its job of keeping you healthy and safe. Hot showers can be more dangerous than you realize. For seniors, now I don't know about you, but for most of my life I adored a steaming hot shower. The kind that turns the whole bathroom into a foggy spa and just melts away stress, right? But after 70, that kind of super hot bathing could actually be putting you in serious danger. Here's why. Hot water lowers your blood pressure. When you step into a really hot shower, your body responds by dilating your blood vessels. That's just a fancy way of saying they widen to try and cool you down. But when your blood vessels dilate, your blood pressure drops. And what happens when your blood pressure drops too much, too quickly? Dizziness, lightheadedness, and even fainting. And here's the really concerning part. Most bathroom falls happen when seniors get dizzy and lose their balance. Did you know that over 80% of falls in the home for seniors happen right in the bathroom? That's because the combination of slippery surfaces, steam making everything slick, and sudden dizziness is truly a recipe for disaster. And let's not forget, falling after 70 isn't just a minor inconvenience. It can lead to broken hips, which often means surgery and long, difficult recovery times. Head injuries from falls can be life-threatening, especially for us as we age. And even a seemingly simple fall can lead to permanent mobility issues, making it harder to stay active and independent. One bad fall can change everything. So, if you're someone who loves a piping hot shower, here's what you need to do to stay safe. Turn the temperature down. Aim for comfortably warm water, not steaming hot. Remember, if your skin turns red in the shower, it's too hot. Install grab bars. If you ever feel even slightly unsteady on your feet, you need something sturdy to hold on to in the shower or tub. Grab bars are lifesavers. Sit down if needed. A shower stool or bench can make a world of difference for safety and comfort. It's perfectly okay to shower sitting down. One more tip, and this is crucial. If you ever feel dizzy or lightheaded at all in the shower, sit down immediately and call for help if you need it. Your safety always comes first. Those super hot showers just aren't worth the risk as we get older. Let's be smart and safe, ladies. Don't forget your feet. They need special attention. Most of us women are wonderful about taking care of our faces, aren't we? We buy our moisturizers, our serums, maybe even a fancy eye cream or two. But let me ask you honestly, when's the last time you really truly took good care of your feet? Here's why this is so important, especially as we age. As you get older, the circulation in your feet naturally slows down. That means they don't heal as quickly as they used to. And this makes them a prime spot for infections, especially if you're not washing and drying them properly. And the biggest foot issue for older women? Fungal infections. Fungus just loves damp, neglected feet. If you're not washing and thoroughly drying your feet every day, bacteria and fungus can start growing, especially between your toes. That's their favorite hiding place. If your feet stay too moist, you're at risk for conditions like athlete's foot, toenail fungus, and even foot ulcers, which can be very serious, especially if you have diabetes. And if you're not trimming your toenails properly, they can become ingrown or harbor bacteria, leading to pain and infection. So even if you're cutting back on full-body baths to protect your skin, your feet need daily attention. Here's a simple foot care routine to keep your feet healthy and happy. Wash them daily, even if you're skipping a full shower. Take a moment each day to wash your feet with mild soap and warm water. It only takes a minute or two. Dry thoroughly. This is key. Dry your feet completely after washing, especially between your toes. This is where moisture loves to hide and infections often start. Use a soft towel and really get in between each toe. Moisturize, but not between the toes. Dry skin on your feet can lead to cracking and discomfort, so moisturizing is important. But avoid putting moisturizer between your toes, as too much moisture in that area can actually encourage fungus to grow. Just moisturize the tops and soles of your feet. And if you struggle with foot pain, swelling, or tingling in your feet, please don't ignore it. That could be a sign of poor circulation, which is common as we age and needs to be checked by your doctor. A good, consistent foot care routine is a simple way to keep your feet healthy, comfortable, and keep you happily on your feet for many years to come. Your private areas need a different kind of care as you age. Now, ladies, let's talk about something that's super important but often not discussed openly. Taking care of our private areas as we get older. This is just a natural part of aging and nothing to be embarrassed about. But it's vital to understand that your intimate area changes quite a bit after 70. If you're still washing down there the same way you did in your 30s or 40s, you could actually be disrupting your natural balance, leading to real discomfort, infections, and irritation that can make everyday life miserable. And we certainly don't want that. Here's what's happening down there as we age and why it requires a gentler approach. Less natural lubrication. Remember menopause? Well, the drop in estrogen levels that happens during and after menopause has a big impact. It means the vaginal area naturally becomes drier and more sensitive. This makes it much more prone to irritation if you wash too aggressively or use the wrong products. Also, shift in pH. Balance. Your vagina is naturally slightly acidic, and that acidity is actually a good thing, Sartara. It helps protect against infections. But over time, this delicate pH balance can shift, making you more vulnerable to both bacterial and fungal infections. Thinner, more delicate skin. The skin in your intimate area also becomes thinner and less elastic as we age. This means that harsh soaps or rough scrubbing can cause tiny micro tears, leading to itching, burning, and yes, even infections. Now, if you're still using strong scented soaps, fragranced body washes, or heaven forbid, douches, please stop. These products can actually destroy the beneficial bacteria that are essential for keeping your private areas healthy and balanced. So, yes, here's what you need to do instead for gentle and effective cleansing. Skip the soap inside. Your vagina is actually wonderfully self-cleaning internally. For the outer area, the vulva, just use warm water or a very mild, fragrance-free cleanser specifically designed for sensitive skin. Less is definitely more here. Avoid scrubbing and washcloths. Your gentle hands are all you need for cleansing. Skip the washcloths or loofahs, as they can be too abrasive and cause irritation, especially on delicate, mature skin. Scrubbing can cause those tiny micro tears we talked about. Pat dry, don't rub. After bathing or washing, gently pat the area dry with a soft towel instead of rubbing vigorously. Again, gentleness is key, and here's something that might really surprise you. Bathing too often can actually lead to more odor, not less, in your private area. That's because overwashing disrupts the natural balance of bacteria, allowing the bad odor-causing bacteria to take over. So, if you've ever felt discomfort or noticed an odor down there after bathing, your routine might actually be the culprit. When it comes to intimate hygiene after 70, less is truly more. Gentle cleansing and respecting your body's natural balance is the kindest and healthiest approach. Hard water can make existing skin conditions so much worse. Have you ever stepped out of the shower feeling like no matter how much lotion you slather on, your skin still feels tight, itchy, or flaky? Well, it might not be your moisturizer that's the problem, it could be your water. Most of us don't give a second thought to the water we bathe in. But hard water, which is common in many areas and is high in minerals like calcium and magnesium, can actually be wreaking havoc on your skin, especially as we get older and our skin becomes more sensitive. Here's how hard water can sabotage your skin health. It leaves behind a mineral residue. Hard water leaves a sort of invisible film or residue on your skin after you bathe. This residue can make your skin feel dry, rough, and even itchy. It's like it's coating your skin in a layer of, mineral deposits. It prevents soap from rinsing off properly. Hard water actually interferes with soap, preventing it from rinsing away completely. This means soap scum gets left behind on your body, clogging your pores and causing irritation. Not good. It can worsen skin conditions like eczema and dermatitis. If you already struggle with dry skin, eczema, dermatitis, or psoriasis, hard water can make flare-ups much more frequent and severe. It just aggravates those conditions terribly. And here's something many older women don't realize. Hard water can also make your hair brittle and thin. The minerals in hard water build up on your scalp, making your hair look flat, dull, and lifeless. It can even accelerate hair thinning over time. Definitely not what we want. So, what can you do to combat the effects of hard water and protect your skin and hair? Thankfully, there are some simple solutions. Install a shower filter. These are relatively inexpensive and easy to install yourself. A good shower filter can remove many of the harsh minerals from your water right at the shower head, making a huge difference in how your skin and hair feel. It's a worthwhile investment. Use a gentle pH balanced cleanser. Regular bar soaps often react with hard water, making them even harsher and more drying. Switch to a mild moisturizing body wash or cleanser that is specifically pH balanced to be kinder to your skin. Always moisturize immediately after bathing. This is crucial, especially if you have hard water. Lock in moisture while your skin is still damp by applying a good moisturizer within a few minutes of getting out of the shower or bath. This helps to counteract the drying effects of hard water and keep your skin feeling soft and supple. You might not be able to change the water supply in your city, but you can absolutely change how you protect your skin from its harsh effects. A few simple tweaks to your bathing routine can make a world of difference. Taking a warm bath before bed can actually help you sleep better. If you're one of the many women who struggle with falling asleep or staying asleep through the night, here's a lovely little trick that could truly change your nights for the better. A warm bath before bed. A relaxing warm bath, taken about an hour or two before you climb into bed, can actually help regulate your body temperature and gently prepare you for deeper, more restful sleep. Now, I know what you might be thinking, but Dr. Emily, didn't you just say hot water can be dangerous? Yes, steaming hot showers and baths can be risky, especially for our heart health, but a warm bath not too hot can actually help your body relax in a way that really promotes restful sleep. Here's the science behind it. Body temperature regulation. As you step out of the warm bath into the cooler air, your body temperature naturally starts to cool down rapidly. This drop in body temperature is actually a powerful signal to your brain that it's time for sleep. It's like a natural sleep cue. Muscle relaxation. A warm bath gently relaxes tense muscles and eases joint pain, making it much easier to get comfortable in bed and drift off to sleep peacefully. Stress and anxiety. Reduction. Warm water is wonderfully soothing and can help lower stress and anxiety levels, which are often major culprits behind insomnia in older adults. It's a lovely way to unwind and let go of the day's worries, but there's a right way and a wrong way to do this bedtime bath trick. Time it right. Take your warm bath about 1 to 2 hours before you plan to go to bed. This gives your body that crucial time to cool down, which is key for falling asleep faster. Use calming scents. Enhance the relaxation factor by adding a few drops of calming essential oils to your bathwater, like lavender. Lavender is known for its wonderful sleep-promoting properties and can really help relax your nervous system. Keep the water lukewarm, not hot. Again, we want warm, not scalding. If you come out of the bath feeling sweaty or flushed, the water was too hot and could actually be stimulating instead of relaxing. Aim for a comfortably warm temperature, like bath water for a baby. That's a good guide. So, if you've been tossing and turning at night, struggling to get a good night's sleep, try adding this simple, soothing change to your bedtime routine. A warm bath before bed might just be the gentle key to unlocking more restful, rejuvenating sleep. Sweet dreams, ladies. Believe it or not, your bathing habits can actually affect your heart. Health. This last fact is a serious one, ladies, so please pay close attention. Most people don't automatically connect bathing with heart health. But after 70, the way you bathe can actually put extra strain on your heart, especially if you already have high blood pressure, heart disease, or any circulation issues. It's something we need to be mindful of to protect our precious hearts. Here's why your bathing routine can impact your heart. Sudden temperature changes can shock your system. If you step into a bath or shower that's drastically too hot, your blood vessels dilate very quickly. As we discussed earlier, this can cause your blood pressure to drop too rapidly, leading to dizziness, lightheadedness, and even fainting, which is especially risky for those with heart conditions. Conversely, ending a bath with a sudden cold rinse, thinking it's invigorating, that cold water can cause your blood vessels to constrict suddenly, which can actually increase your blood pressure and put extra strain on your heart. Neither extreme is ideal for heart health. Staying in a hot bath too long can lower oxygen levels. Those long, luxurious, super hot soaks might feel relaxing, but they can actually make you feel lightheaded and weak. That's because prolonged exposure to hot water can reduce how much oxygen reaches your brain and heart. Not good for anyone, but especially concerning if your heart is already working harder than it used to. So, what should you do to keep your heart safe and happy while bathing? It's all about moderation and being gentle with your body. Avoid extreme temperatures. As we've said, steer clear of both scalding hot and icy cold water. Stick to comfortably warm water for both showers and baths. Warm is relaxing. Extreme temperatures can be stressful for your system. Keep bath time reasonably short. Long lingering baths might sound lovely, but for heart health, shorter is better. Aim for around 10-15 minutes in the bath or shower. Any longer, and you risk putting unnecessary stress on your heart and circulatory system. Get up slowly and carefully. When you're finished bathing, don't rush to jump out of the tub or shower. Take your time. Stand up slowly and deliberately, and make sure you have something sturdy to hold on to if you feel even a little unsteady. Listen to your body. This is the most important tip of all. If you ever feel lightheaded, weak, dizzy, or short of breath while bathing, get out of the water immediately and seek help if needed. Your heart health always comes first. Bathing should be a refreshing and cleansing experience, not one that puts your heart at risk. By making a few simple adjustments to your routine, you can bathe safely and comfortably, while protecting your precious heart health for years to come. Life lesson. So, there you have it. 8 surprising facts about bathing after 70 that every woman needs to know. The biggest takeaway, when it comes to bathing as we age, gentle is truly golden. Less is often more. Listen to your skin, listen to your body, and adjust your routine to what your unique needs are now. It's not about being dirty if you don't shower every single day. It's about being kind to your skin, protecting your health, and adapting your self-care to this beautiful new chapter of life. Now, I'm truly curious, did any of these facts surprise you? Were there any aha moments for you as you were reading? Please drop a comment below and let me know what you think. Let's start a conversation and learn from each other. And before you go, if you found this information helpful and empowering, please don't forget to give this a thumbs up and subscribe so you can stay connected and receive more practical tips and insights for living your very best life in your golden years. Take wonderful, wonderful care of yourselves, ladies. Remember, healthy skin, a healthy heart, and a happy you. That's what it's all about.